Hello, everyone. My name is Dr. Marianne Gausche-Hill. I'm the medical director of the Los Angeles County Emergency Medical Services Agency, professor of clinical emergency medicine and pediatrics at the David Geffen School of Medicine. I'm also clinical faculty at Harbor-UCLA Medical Center in the departments of emergency medicine and pediatrics, and senior consultant for the EMS for Children Innovation and Improvement Center. And today I'm here to talk to you about a topic that we've all had to face with the increase in behavioral health conditions that we're seeing, especially in children. So the title of my talk is Safe Control of the Agitated Pediatric Patient. In regards to disclosures, as I said, I'm a senior consultant for the EMS for Children Innovation and Improvement Center. And this is funded through HRSA HHS, and you see the award there. And I need to state that the contents are those of myself and do not necessarily represent the official view of nor endorsement of any of the federal agencies, including HRSA, HHS, or the US government. So thanks. Here we go. So we're going to start out with some of the resources that are out there. This is a great algorithm that can be incredibly helpful, along with additional resources that are at the site. And we'll have a QR code at the end so you can click onto it. But this is by the EIIC and TREC, which is Translating Emergency Knowledge for Kids. As you can see, the algorithm starts out in recognition of agitation, some of the initial strategies like de-escalation and calming, and then it moves to what is your assessment? What do you think is going on? And potential pharmacologic interventions, if indeed those are necessary. All right, let's transition to some of the management strategies. And the key thing here is to be multimodal, right? You want to individualize it for that patient because that patient has their own unique past medical history or psychiatric history. It's nice if it's multidisciplinary, meaning involving the nursing staff, and it may involve the restraint team too, so they can all participate. And it's very good that there's good communication with all the members on the team that are caring for this particular patient. And I mentioned collaborative because I think it's key to have a really strategy before going in and caring for these patients and restraining the patients as well. So the multimodal approach also indicates that you should have an idea of the etiologic factors to have a really strategy before going in and caring for these patients and restraining the patients as well. So the multimodal approach also indicates that you should have an idea of the etiologic factors leading to the agitation. And some of, I said multidisciplinary, but the multimodal would be also using based on what you believe the etiologic factors are. That will be very helpful in terms of using non-pharmacologic strategies to de-escalate or verbal de-escalation strategies such as a calming voice, and we'll get to that in just a second. And then finally, choosing the medication that's based on age, specific needs, and this is important. The route can be very, very important. As an example, for autistic kids, it may be best not to do something intramuscular. All they know is you're hurting them. So oral medications are preferred or no medications. And so we'll talk more about that in a bit. And again, it is individualized for that patient. We use our whole team, our now multidisciplinary team, and multimodal implies not only environmental issues that can be done, non-pharmacologic calming methods, but verbal de-escalation, as well as pharmacologic. And then finally, again, as if needed, physical restraint. We've talked a little bit about that. I wanted to bring up the verbal de-escalation and some of the principles. This is the 10 domains of verbal de-escalation. And I'm going to go into another mnemonic that we use here in LA County for our EMS providers, paramedics in the field. But I think these are some very standard. If you look at any resource. This is like very much a standard set of principles, and I think it's really helpful. So respect personal space, do not be provocative, do not respond with a loud voice or with anger. That is only going to cause escalation. You want to establish verbal contact, you want to be concise. You do not want to go into huge explanation. I think you just use as few words as you can. Identify wants and feelings can be very helpful. Sometimes validating what they say is important, and you want to listen very closely because they may give you clues to what the trigger of their agitation is. Agree to agree or disagree. Don't get into fights. You don't need to win this one. The key thing is just saying, okay, I understand you want to go home, but you cannot go home right now. So let's work together. Lay down the law, and this can be very important. They're pounding the wall. You cannot do that. If you continue to do that, we will need to restrain you. So sit down and remain quiet so we can continue our evaluation, something like that. Choices can be really helpful, but remember, you have to have choices that you can actually act upon. Would you like me to examine you? Is not a good choice. You're going to examine them one way or the other. You can either sit down and I'll begin my exam, or you can remain standing and I'll examine you that way. Okay, so that's a choice you're willing to follow through with. So I think that's really key. And optimism, let's work together so we can get you home as quickly as is feasible. That's optimistic. Not that they are going home, but we'll try to get you home as soon as we can. And then having the patient understand what the steps in the care are and what the next step is, I think is really helpful. I mentioned a mnemonic that we use here in LA County for our EMS. It's called the eraser mnemonic, and you know how mnemonics are, right? You remember eraser, but you can't remember what it stands for. So it can be a little bit challenging, but I find this one pretty easy to remember. So eyeball the patient, you're trying to see if there's some suggestion of violence. Certainly they're agitated, so they might be pacing, they may be talking to themselves, but eyeballing them and get a kind of a picture of, do you need to back off and bring in reinforcements or straight away restraint team. So eyeball the patient. R is respect the patient's space. So that's that privacy issue. And a single member of the healthcare team is interacting with them so that you can make eye contact. You should identify yourself. Hi, my name is Dr. Gausche-Hill. What is your name? And then use their name, makes it a little more personal. And they see you as the leader. And that's very helpful in terms of focusing for them. Sensible listening. So listen, don't constantly interrupt them. Let them say what they need to say. And as they take a breath, if you need to interject some instructions or whatever, do so. But I find listening really, really helpful. And because I get an idea of what the triggers are. Establish expectations. This is what's going to happen during your stay here. And this is why is very, very helpful. And then reasonable choices, we talked about that. You want to give ones that are actionable, so it gives them a little bit of control and it makes them feel that you are respecting them by allowing them some measure of control, if indeed that's possible. So let's go on. We talked about managing the environment a bit. We talked about some of the de-escalation techniques. And now let's get into non-pharmacologic interventions, calming. And a lot can be done with just communication alone and eye contact. So you use a calm, neutral, not loud, and empathetic voice. I really like validating the way they feel. So if you see they're pacing, you're pacing. I'm so sorry you're going through this, I think is very helpful. And you want to communicate at an eye level, not look down on the patient if at all possible. You want to use clear, concrete, and simple language, as I said, and be concise. This issue about reunification or separation, generally in the beginning of an encounter, I like the parent with the child, so I see what that encounter looks like and that dynamic. But it may be very clear very early on that you need to separate the parent. And so sometimes reunification with the parent is good, but one way or the other, if it's an adolescent, you do need to interview the adolescent alone and the parent alone, and then them together. A lot of information can happen with those 3 different encounters. And I'd have a colleague go out and talk to the parent, or just have the parent wait outside while I talk to their adolescent, as an example. Some of the things that can be extremely calming: food, drink, that kind of thing. I actually find I don't have it on the slide, and I probably should, but playing videos, we have a big screen, and to be able to play videos is really helpful. They focus on something else, listening to music. But again, you've got to be careful in the beginning what items are allowed in the room. And once they're calm and you feel pretty comfortable, you may be able to bring other objects in that are relatively safe, that can provide additional calming. There are these calming kits, so you can give them balls to squeeze, rubber balls that aren't hard, they're soft, and so they won't hurt anyone. Those kinds of things I think are helpful, and having food or drink available. I think utilizing the resources such as the EMS for Children Innovation and Improvement Center and TREC tool. Here's a QR code that's going to link you to the resources that you need, that EIIC algorithm, which I think is really helpful, and the medication table. I personally want to acknowledge Drs. Patrick Kelly and Eric Chung for their assistance with me as I developed this talk for you. And obviously the wonderful expertise of the EMS for Children Innovation Improvement Center and TREC, for them really coming together to collaborate on these resources that will help you take better care of your patients. Thanks for listening. You can email me at mgausche-hill@dhs.lacounty.gov or on Twitter at mgausche-hill. Thanks so much.